All right, good afternoon. Thank you guys for coming. It means a lot to me and also Memorial. I want to thank the marketing department for asking me to do this. I think it's something that's very important. What we're going to talk about today is stroke awareness. My name is Dr. Gray. I'm the Director of Emergency Medicine here at Memorial. And this is part of the Lake Charles Memorial News Series. And today's topic is stroke, warning signs, and prevention. We have to say this now that I don't work for any of the companies that we're going to talk about, including the American Heart Association, Stroke Association, or the makers of TPA medication. It's one of those legal things we just have to say now. So no stroke. Save a life and make a difference. Who's had a stroke here in the past? 1, 2, 3. So a handful. So you guys can understand how devastating this can be and how important it is to recognize strokes very early on. And in the discussion today, we're going to talk about why you should care about stroke. I'm going to teach you everything you need to know about strokes, the risk factors, when a stroke occurs, what should you do, and then lastly, can you actually prevent a stroke from happening? So about 800,000 suffer a stroke each year. About 3/4 of these are new strokes, and then about 25% are recurrent strokes. So it's the number 5 cause of death in the U.S. That's a pretty staggering number. Yes, sir?
Can you have a stroke and not know it?
Absolutely. Absolutely. But it's rare. Usually you'll know something. Something's not right. And those are the ones that's very difficult for us to diagnose as well. So about 1/3 of Americans cannot identify appropriately warning signs of a stroke. How many of you guys can recognize at least 1 or 2 signs? Good. So you're not in the statistic. You're the 2/3. So something surprising here, men are more likely than women to develop a stroke. However, women, you got the bad end of the deal. You're more likely to die from a stroke.
That's because women give strokes.
Exactly. You're exactly right. I was going to say that, but so I don't want to get a lot into the technical aspect and terminology, but something important for you to understand is something called atherosclerosis plaque, and that's something that all of us start developing when we're about 20 years old. And it's basically a process of aging inside the blood vessels, whether it's in your legs, your heart, your brain. But it's basically a buildup of fatty cholesterol, calcified deposits that lines the inside of the blood vessel. And that's the key to most of these strokes that we're going to talk about shortly. So what is a stroke exactly? Very simple. It's a lack of blood flow to the brain, hence lack of oxygen supply to the brain. So anything can cause a decrease in blood flow, and that's what causes a stroke. Now, how long the brain tissue actually goes without oxygen and blood supply depends on how severe the stroke symptoms are and what permanent disabilities you'll be left with. So there's 2 types of stroke. There's ischemic, which is a blockage, and then hemorrhagic, which is bleeding in the brain. Those account for only about 13%, which is a good thing because these down here tend to be very catastrophic. So we're going to talk about the majority, which are 87% of all strokes. And there's basically 2 types, thrombotic and embolic. I don't want to get, again, too much into the details of this, but there's some key differences between the 2. So I think it's always good in a lecture like this, if you're not familiar with the terminology and some of the science behind it, if I kind of say something and then you watch a short video to re-enhance it, or vice versa. So this is, I think I've got 4 videos, and this is the first. That may be a little too loud. We had some.
Understanding stroke. A stroke occurs when the
Okay,
blood
sure.
supply to the brain is blocked or reduced. That can happen because of either a blood clot that breaks off and goes to the brain, or sometimes there's a narrowing in one of the arteries that supplies blood to the brain. In some cases, bleeding in the brain also causes a stroke. But anything where you have interrupted blood supply to the brain can cause a stroke. When a stroke happens, some of the brain tissue dies. How much of the brain tissue depends on how severe the stroke is. Rapidly seeking medical attention is critical. A stroke is sometimes called a brain attack, which, like a heart attack, is always a medical emergency. There are two common types of stroke. One of these types is called hemorrhagic stroke and occurs when a weakened blood vessel ruptures in or near the brain, leaking blood into the brain and causing the brain cells to die. The second, more common type of stroke is called ischemic stroke. It occurs when a blood vessel, an artery carrying blood to the brain, becomes blocked. Without blood supply, brain cells, deprived of oxygen and nutrients, can start to die within a few minutes. Ischemic strokes can have thrombotic or embolic causes. Thrombotic strokes are caused by a blood clot, medically termed a thrombus, in an artery supplying blood to the brain. Blood clots usually form in arteries affected by atherosclerosis, the buildup of hardened plaques on the inner walls of arteries. If an atherosclerotic plaque is disrupted, a thrombus forms on top of it and blocks the vessel, stopping the flow of blood. In an embolic stroke, a blood clot, called an embolus, forms somewhere else in the body and travels via the bloodstream to the brain. Eventually, the clot reaches an artery small enough to block its passage. It lodges there, obstructing the blood flow and causing a stroke. A stroke is always a medical emergency. That's why it is important to recognize the signs of a stroke and take emergency action as quickly as possible. A stroke is sometimes called a brain attack, which, like a heart attack, is always a medical emergency. There are two common types of stroke. One of these types is called hemorrhagic stroke and occurs when a weakened blood vessel ruptures in or near the brain, leaking blood into the brain and causing the brain cells to die.
That's the rare type.
The second, more common type of stroke is called ischemic stroke. It occurs when a blood vessel, an artery carrying blood to the brain, becomes blocked. Without blood supply, brain cells, deprived of oxygen and nutrients, can start to die within a few minutes. Ischemic strokes can have thrombotic or embolic causes. Thrombotic strokes are caused by a blood clot, medically termed a thrombus, in an artery supplying blood to the brain. Blood clots usually form in arteries affected by atherosclerosis, the buildup of hardened plaques on the inner walls of arteries. If an atherosclerotic plaque is disrupted, a thrombus forms on top of it and blocks the vessel, stopping the flow of blood. In an embolic stroke, a blood clot, called an embolus, forms somewhere else in the body and travels via the bloodstream to the brain. Eventually, the clot reaches an artery small enough to block its passage. It lodges there, obstructing the blood flow and causing a stroke. A stroke is always a medical emergency. That's why it is important to recognize the signs of a stroke and take emergency action as quickly as possible.
Okay, so that kind of just sums up the pathophysiology. So who takes aspirin or Plavix here? So a majority, okay? So what that does, this thrombus, that's where the atherosclerotic plaque is. It's built up of calcium and cholesterol deposits. When they break a little bit, they bleed inside the blood vessel. Well, you think that's not a big deal, but your platelets actually attack that area and start to clot right at that area. So the Plavix and the aspirin actually prevents that process from actually happening. AFib, who has AFib? No, only 2. So you're on a blood thinner? Blood thinner? Good. Good, okay. So what that does is actually prevents these emboli forming inside the heart chamber, and I'll show you that in just a moment. So during atrial fibrillation, the top part of the heart actually just kind of quivers as opposed to actually contracting the blood out. And here's a video just kind of depicting that.
Atrial fibrillation, or AF, is an irregular heartbeat. It is caused by a breakdown in the natural pacemaker that is responsible for making sure that the 4 chambers of the heart contract in a coordinated way to pump blood around the body. Under normal circumstances, the pacemaker first makes the 2 chambers at the top of the heart, called atria, contract, squeezing blood into the 2 lower chambers, also known as ventricles. These in turn are triggered to contract, pushing blood out of the heart, into the arteries, and out to the body and the lungs. In AF, a malfunction of the pacemaker interrupts this coordinated sequence of contractions, causing the atria to twitch erratically, known as fibrillation, and the ventricles to contract more often and irregularly.
So for some reason that video wasn't working right, but the top part of that atrium, again, just kind of quivers as opposed to actually contracting the blood out of the chamber into the ventricle. So causes for a hemorrhagic stroke, this is where we're getting to your question. Basically, it's a weakened blood vessel, and that can be from aneurysms, which is just a ballooning, a swelling out of the arterial wall, which causes a weak spot. And then also there's some arterial venous malformations, and that's kind of a congenital abnormality where a vein and an artery kind of meet together, and it's kind of a high pressure and a low pressure situation. And so inherently they're just kind of weak spots in those blood vessels. So TIAs, who's heard of a mini stroke or a TIA? Any of you guys had one?
Yeah.
Frightening?
Yeah.
Absolutely. So these are what we call warning signs, and the good thing about them is that it's only temporarily blocked. So blood gets to the brain and then suddenly stops for whatever reason, and then maybe it's because you took your aspirin and your Plavix and your Coumadin, and then the symptoms kind of resolved itself. But these are very, very similar. In fact, you can't really tell the difference between a TIA and a stroke except with a little time. TIAs go away pretty shortly, strokes don't. They take a long time to get better, if they get better at all. So a person who has a TIA is about 10 times more likely to have a stroke. So this would be a medical emergency. A lot of evaluation needs to go on to see if you're at risk of developing a stroke and if we can prevent it from ever happening to begin with. So, what kind of symptoms are you going to get with a stroke? It all depends on what blood vessel in the brain is supplying that part of the brain that's responsible for your speech, your hearing, your leg movement, your sight. So that's what really gives you your symptoms. So it just really depends on what blood vessel, how big of a branch off the main blood vessel, depends on your symptoms. So stroke is absolutely preventable, beatable, and treatable. 80% can be prevented. That's a big number, 80%. But you got to start early. Can't wait till you're 80. Long-term effects of a stroke can be minimized if you get immediate medical attention. And then more people are surviving and beating stroke mainly because of community awareness, just like this lecture topic today. So warning signs of a stroke.
Quiet, please. Wait a sec. I'll take one. Oh yeah. All right. All good. Take care. Way to go. Nice. Bring it on. Gotcha. I'm here for you. Oh no. Please, please, please. I'm waiting. Interesting. Not buying it. Not fair. That's it. This conversation is over. Oh, brother.
Body language can tell you all sorts of things.
I'm having a stroke. I'm having a stroke.
Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time. Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
So the whole idea here is learning how to recognize stroke symptoms, and as soon as you recognize them, you need to act on them. Because remember, time lost is brain lost, all right? So when a stroke occurs, what do? So we've got this really easy acronym, which is FAST, and it stands for face, arm, speech, and time. It kind of just wraps up a basic summary. It's real easy. So if you have facial weakness, and gentlemen, I'm not talking about your wife looking like this. She's pissed off, you need to get out of the house. But if it's one side, that's where you got to be careful. So two sides, that means your wife's mad at you, get out of the house. One side, maybe something's going on. So arm, you know, the most sensitive thing that we do when we're testing for motor strength, most patients, or a lot of patients will say, I feel fine in my arms, nothing's wrong. I just have this facial droop. But if you have them hold both arms, palms straight up, and one starts to turn in, that's the most sensitive sign. It's what we call a pronator drift. And that's something that a lot of patients don't even realize that they're weak in that arm. And we kind of pick up on that. But certainly if one's, you know, out and one's drooping, that's pretty obvious. Speech difficulty. So if someone's having trouble getting the words out, they know what they want to say, but they can't say it, or their speech is garbled, it's slurred, it sounds like they've been drinking all night. And then time. Time to call 911, and it's also very, very important to look at your watch as soon as you recognize someone having potential stroke signs, and make note of that, because we're going to talk about that in a minute and why that's so important. So FAST, just a review here. Spot a stroke is the FAST acronym. Facial drooping, one side of the face, or is it numb? Arm weakness, again, is it weak or numb? Does the arm drift downward? And again, we talked about that, holding straight up, palms up. If one starts to rotate in and they can't keep it out, that's something that's important. Speech difficulty, again, hard to understand. Just have them say something simple. My name is Sarah Smith. And if they can't say it, or it's hard for them to say it, something's going on. Again, it's time to call 911 and note what time the symptoms began. Now, there's a lot of other sudden symptoms that are a little concerning as well. These are a little vague, and oftentimes you think, oh, I'm just having a little inner ear problem, I'm a little off balance. But some of these, numbness, weakness of the leg, confusion, trouble understanding, trouble seeing in one or both eyes, trouble walking, dizziness, loss of balance or coordination. There's parts of the brain that's specifically meant just for our balance. And so patients will kind of, but that's their only symptom. And they're thinking, oh, it's just an inner ear vertigo type situation, but it actually can be a stroke. And then also unexplained headaches. If you've occasionally had a headache and it's just a usual headache, not a big deal. if you've never had a headache or this is something completely out of the ordinary, this is where your question comes in. Could there be a bleed somewhere inside the brain? So what do you do if you think someone's having a stroke? 911, look at your clock, and note that mentally. So why is it all important to recognize this at all? And the reason is because we've got some really neat treatment options that have really been in the last 20, 25 years for this drug called TPA. And then thrombectomy is something that's been in the last 10 years, which is really cutting edge technology. So TPA is a medication that is a super, super powerful blood clotting dissolver. So you have a blood clot, it's blocking a blood vessel, we need to dissolve it. And the way we do it is to give TPA. However, only certain patients can benefit from this. And we'll go over that in just a minute. But just a little short video on TPA. So what did you get from that? 90% of patients with a stroke don't qualify because they don't get to the ER quick enough. That's a huge number. And then of that 10% that we can potentially treat, only about maybe 60% will not be able to get treated as well. So it's a very small patient population that we can actually help, again, because of lack of awareness in the community. So that's what we hope to get out in the community over the next several years to understand the importance of that. So again, we have to be extremely selective on who gets TPA. First of all, we have to rule out stroke mimickers. Anybody diabetic? Take insulin? No? Okay. So a lot of time, you do? Have you ever had a sugar of 20? No. No? Pretty good. But a lot of patients who are taking insulin, they forget to eat, they're not hungry, they take their insulin, blood sugar levels go down to 20, 25, and then they're slurring their speech, they're confused, they may have facial droop or arm weakness. Well, that's something you want to, just clear up by giving them a little sugar water. But again, it's something that we always think of in the very beginning. Secondly, we always have to make sure you're not bleeding in the brain before we give you a very, very powerful blood clot medicine, because that's just going to make the bleeding worse and then catastrophic. So the FDA has approved 2 different time frames, 3.5 hours and 4.5 hours. And that's talking about the onset of symptoms. So 1 o'clock, your symptoms start, and you think about it for an hour or two. And then 3 o'clock, okay, let's go to the hospital. Well, it takes us about an hour to get everything done that we need to do to make sure you're not going to have an adverse outcome from this blood clotting medicine. So you can see at 3.5 hours, we're already 3 hours, we're getting pretty close to jumping into this next category, which is FDA approved, but the benefit and risk is not near as great as with the 3.5 hours. So that's why getting to the emergency department very, very soon is very important. And then again, we have to assess the bleeding risk from each and every patient that comes in who may technically qualify for TPA treatment. So someone's on Praxa or Eliquis?
Yes.
Okay. So if you take your Eliquis this morning and you have a stroke at 7 o'clock tonight, we can't use TPA because the bleeding risks are exponentially high. And the last thing we want to do is make your life more miserable. So there's a lot of tricks involved with this decision making, and it's very stressful because the last thing we want to do is never cause any harm. Yes, sir.
In the old days, they used to tell you to take an aspirin or something to kind of help alleviate while you're getting to the hospital or whatever. And I'm hearing now that's not.
That's no longer recommended because, remember, 13% are hemorrhagic. That means they're bleeding in the brain. And aspirin will make your platelets not work, which means it's going to enhance the bleeding, will enhance the stroke and cause.
Aspirin thins the blood more.
Correct. It basically makes the platelets in the blood not clot. So you're kind of a free bleeder, if you will, but not really. So yeah, that used to be, and that's a very good question because it used to be recommended, but now they've taken that recommendation away until we can prove or disprove that there's any hemorrhage going on. This medication is the whole key of getting patients better in certain circumstances.
Excuse me.
Uh-huh.
What kind of test proves there's no bleeding?
Good question. So, we talked about making sure their blood sugar is okay, making sure there's no other mimickers, but we do a CAT scan. And a CAT scan tells us it's very, very sensitive that there's no bleeding. That's all we want to know because we're trying to make the decision, do I have time to give this medication, which takes an hour, after the hour of working you up. So, but we want to make sure there's no bleeding anywhere. We don't see strokes on CAT scan in the first 24, 48 hours. We don't care about that. We're only interested in making sure you're not having any hemorrhage in the brain.
What about nitrics?
I'm sorry?
Nitrics?
There's still a lot of research on that. We don't use that currently. That's really all. I don't even know the latest research on that because it's just not really available. So.
Got it in my pocket.
Oh, you're talking about nitroglycerin?
Yes.
Misunderstood. I thought you said nitros, which is a nitrogen-oxygen mix. So what about nitroglycerin?
You take that, you don't take aspirin.
So nitroglycerin is basically for anginal chest pain. And what it does is it dilates the coronary arteries that's in the heart. So a heart attack and a stroke are really the same thing, just two different organs. One's the heart, one's the brain. So nitroglycerin actually helps dilate those blood vessels in the heart. And there's really been no studies proven to show that they actually dilate in the brain. And if you are having a hemorrhage, it could potentially worsen that. So I definitely would just leave that for your anginal chest pain. Okay. So thrombectomy, this is the latest kind of cutting edge technology. We don't do this at Memorial. However, we are partnered with Tulane Medical Center and also Lourdes of Lafayette. I think they're kind of sister hospitals. And they are doing this. And it's pretty neat that who's had an angiogram of their heart, a heart cath? You are too healthy. One person? Wow. So basically what they do is they put a catheter in the femoral artery or the radial artery, feed it up to the brain. Usually they stop at the heart and work on your heart blockages. This way they're going all the way up into the little blood vessels in the brain, way up there. So a longer wire. And then what they're doing is they're looking at this, they're finding the blood clot because they shoot dye, take x-ray video pictures, and they see where the blockage is. And then they kind of zig this little wire, and these are super, super tiny, past the blood clot, and then they start uncoiling it in the reverse direction, and they capture it, and then this end of the tube, which is this magnified, is a suction device. So it just kind of starts sucking that clot out. And if you want to see what one looks like, that's it. So this little thing here was a blood clot in a blood vessel in the brain. So the number of specialists that's doing this, there's just not enough of. Hopefully in the next 10 years, they'll be more diverse and through every city throughout the state.
What frequency does that occur? You said
So-
Lafayette. Could you be there in time to have it done?
So again, there are certain symptoms, certain symptoms criteria that have to be met, and the time frame is up to 8 hours. So if you get here at 4 hours, and that second cutoff was 4.5, well, we can't give you the TPA medication. However, we can take an hour to do our usual workup, and then we will call Tulane on a video monitor, and they actually interview the patient, kind of like Skype or FaceTime. And they'll talk to the patient and the family and explain the risk and benefits of taking this out. So at that 4.5 to 8 hour window is when we're really looking to do this. I think they may extend that to 10 or 12 soon, but not as of yet. Yes, sir.
I've had 5 stents put in my heart. Seems to be doing fine. But I guess they had to do that cath
Yes, sir.
before they did the stents.
Right. So same principle. They'll feed the catheter up, shoot some dye, take a video x-ray, see where the blockages are, and then they can expand those blockages. They can put a stent. They can suck the clot out. So it just depends on what's there, when they're dealing with it. I think they are starting to do some stenting in the brain, but it's a lot more tricky. The blood vessels are much smaller, and then the roadway, the map getting to it, is way more cumbersome. Okay, so who has a flip phone? You got to get a smartphone if you want this. So this is a mobile application. Again, it's called FAST. It's through the Stroke Association or iTunes. It's free. And basically it just gives you a few things to just remind yourself on what to look for. Because a year from now, you're probably not going to remember a lot of this stuff, but it's a free app and it's pretty easy to use. Just kind of enhances as a reminder. So can you prevent a stroke? Who says yes? Nobody says yes? All right, good. Good answer. So 80% of all strokes are preventable. Now, how do we prevent that? There's some things we can't change in life. We can't change our age, hereditary, race, and a history of a stroke. All of these things put you at risk of having a stroke, but we can't change that. However, the things that we can change are controlling your high blood pressure, don't smoke, consume less sodium, lower your cholesterol levels, lose excess weight, and get physically active. All of these are very important for a healthy lifestyle. Again, you can't start at 80, you got to start at 20. So, but you can catch up a little bit. So the number one thing that we can prevent stroke or high blood pressure control. That's the number one reason why strokes happen, is because blood pressure has been poorly controlled over the years. So where can you learn more? The American Stroke Association is actually a branch from the American Heart Association that was developed about 20 years ago in 1998. And they've kind of branched off because they realized that strokes are huge, just like heart attacks were initially. So it's a whole nother, division, same mission statement. They want to build healthier lives, free of cardiovascular diseases and stroke. The single purpose is what really drives everything they do, and then the need for our work is beyond question. I think we can probably all agree on that. So again, American Heart Association, American Stroke Association, they're very dedicated through support, through scientific research, through funding, whether it's governmental spending for that research, and then also to educate the public and build national awareness. It's still amazing to me, every day we get a patient that's come in with stroke symptoms, 6, 8, 10 hours, They thought it was going to go away. It didn't, and they're no longer eligible for treatment. So then they're left with this permanent disability. And then they don't get to discharge and go home. They have to go to a rehab center for 2 or 3, 4 months. If they're lucky. Sometimes they're not. So strokeassociation.org, you can Google anything and you'll come up with all of this stuff. But information on the signs of stroke, that fast mobile application, again, will help you spot a stroke. And you can teach all your friends and your neighbors who didn't get to eat the lunch today. All right, so that's kind of it for the presentation. Questions?